New technology at the University of Missouri is diagnosing respiratory conditions sooner. MU Healthcare recently conducted its first scan of a patient's lungs using xenon MRI. It's the second healthcare system in North America to begin imaging patients using this process when a patient inhales hyperpolarized gas during an MRI scan. The image on the left, that's a typical scan. The image on the right, that's from the xenon scan.
What makes this technique especially unique is that it's not imaging tissue. What this technology does is image the gas itself.
After 30 years of research, hyperpolarized gas was recently approved by the FDA for patients ages 12 and older. The gas is now produced at the University of Missouri in the Next Gen Precision Health Building.
Fortunately, because we've been performing it for research, we are ready with the people who can now perform this clinically.
This is how it works. The patient inhales the gas while the MRI unit scans the lungs. The process takes only 10 to 15 seconds.
And that's what we call ventilation imaging. And you can see that that's one part of the gas exchange, is just getting the air into all areas of your lung.
Doctors say xenon MRI really helps with lung diseases such as cystic fibrosis, COPD, cancer, and asthma.
And another one that I think is very intriguing is what many people call long COVID or post-COVID syndrome. So these are people who got COVID, recovered, but then have persistent symptoms like shortness of breath.
By using FDA-approved hyperpolarized xenon gas as an inhaled contrast for MRI scans, doctors say they can accurately measure lung ventilation or function in high detail like never before.
The really interesting thing about xenon is that we can not just look at where the xenon goes in the air spaces, but we can watch it transfer into that tissue, what we call the interstitium, and transfer into the red blood cells. So we can see all aspects of gas exchange with the xenon in a single breath hold that takes less than 20 seconds.
Doctors are provided with a highly detailed image of the patient's lungs to better help them diagnose and treat the disease.
I want to see your lungs. I want to see how your lungs are functioning, and I want to be able to make a clinical decision and manage you based on your own anatomy. The patient-specific approach, precision medicine.
And in diseases that are called obstructive lung diseases like asthma and COPD, the air doesn't get everywhere. And so we can see which areas of the lung ventilate well and which areas of the lungs don't ventilate. And then if we give a treatment, we can see whether that actually improves lung ventilation in that patient, so that we can direct our treatments at what's actually causing that patient's symptoms. We can also learn more about each of these lung diseases in different patients and the relative contributions of all of these things.
Doctors say xenon MRI provides a better way to understand the progression of lung disease without exposure to radiation.
For some lung diseases, we do CAT scans twice a year, and over 20 years, that's a lot of radiation. If we could replace that with something like xenon gas MRI, now I've taken 20 years worth of radiation and I've turned it into no radiation.